This week, New South Wales COVID cases have hit record levels.
633 cases.
681 locally acquired cases.
Today continued the
We
trend.
had 644 locally acquired COVID cases.
And with them came more restrictions.
The Greater Sydney lockdown will extend until the end of September.
From Monday, LGAs of concern will be subject to curfews from 9 p.m. to 5 a.m. and only be allowed 1 hour of exercise. An outdoor mask mandate will come into effect for all of New South Wales.
We need these measures to slow the growth of this escalating outbreak. I do not want to be standing here every day announcing these high rates of hospitalisation and these deaths. Every one of these deaths is someone's mother, father, grandmother, grandfather.
And with the additional restrictions come additional powers for police.
If someone enters an LGA of concern without excuse, not only will they be fined, they will be sent home and they will have to self-isolate for 14 days.
But questions remain as to why the tough restrictions have taken so long.
We have thrown everything at this.
Why didn't you throw everything at it at the start? Why has it taken 8 weeks of lockdown for you to throw everything at this?
Why has it taken?
Excuse me, I'll get back to you in a second.
Do you expect people to buy that? Because you've been dragged kicking and screaming every step of the way here.
You did have a list of things that you could have done earlier that you didn't do.
No, not at all. Not at all.
Yes, this is the list of things that this is the list of things we could have done earlier
I'm sorry,
that we didn't do. So why is the question?
This is the list we received last night.
There was a brief note of contrition from the Police Commissioner.
In hindsight, do I wish that I raised curfews day one? Yeah, probably, but you probably would have laughed me out.
One of the people laughing him out might have been this bloke 4 days ago.
We look worldwide in terms of what's working, and we don't believe a curfew is what will work.
So as the outbreak spreads, the restrictions tighten and the messaging confuses. Is New South Wales learning that hindsight is 2021?
I don't want us to ever look back and say we didn't try, we didn't put everything into this.
We're joined now by Professor Mary Louise McLaws. Mary Louise, a lot of hindsight going on with the Premier today, but are these new restrictions the missing ingredients to getting this outbreak finally under control?
Good evening, Lisa. Probably not. These restrictions should have happened much earlier. What you do in outbreak management is you put everything under stringent lockdown and stringent restrictions right at the beginning so that you get full cooperation. But now ratcheting it up so it's tighter and tighter makes people feel more and more uncomfortable. And as they've already said, they're not even sure if the curfew will work, because what we're not getting is really good transparency about how the majority of cases are occurring. Are they occurring at work? Are they occurring socially? Are they occurring between visits between infected households and non-infected households, or are they occurring at night through socialising? It is very difficult to determine whether these new restrictions will work. And also what is not happening is a uniformity across local governments. Because don't forget, the virus doesn't understand these arbitrary areas, and sometimes even in the same postcode there are two local government areas, and so you could have restrictions on one side of the street, not on the other. So it really should be across all of Greater Sydney.
So, Professor, you make the point that, you know, we don't even know if these curfews are necessarily working. They're actually unclear as they deliver it, whether they're even working. The Premier I'm talking about and the Chief Health Officer. How are people supposed to have confidence if there's not even confidence amongst the leadership group who are announcing the restrictions?
Well, that's difficult, isn't it? And this is where we are at the moment. We're at a point where they are potentially losing the most important ingredients of taking control of the pandemic, and that is public confidence and public cooperation. And transparency is one of the most important ingredients, because with that goes cooperation and trust. And as I mentioned, we need to know exactly how the cases are occurring. We've got about 80% of cases have not been in full isolation when they've been infectious. Who are they? How is this occurring? And then the people in these hotspot areas may fully cooperate and understand that they haven't been doing what they could have been doing, but they're not receiving that very direct information.
Well, Professor, the New South Wales Premier said the lockdown will last until the end of September. Is that enough time to get the cases down, or is it just about buying time to get the vaccination rates up?
Well, if you're going to use that time just to get the vaccination rate up, the 16-year-olds to 39-year-olds probably represent about a third of all the population across Greater Sydney. And they will have to have 2 doses. The first dose will only protect them, and this is great, from death, hospitalisation, severe infection, but it doesn't really impact the ability of each person to prevent transmission, because that first dose isn't enough to fully maximise your immune response. You need that second one, and that occurs 28 days after the first. And then you need another 14 days to maximise your immune response. So that's 42 days. So they better have a fantastic plan to vaccinate the majority of the people who are sadly infected, and that's the young.
Mary Louise, just quickly, there are a lot of concerned parents out there. The current vaccine rollout doesn't involve kids. What is your advice for them?
My advice to them is that I understand their concern, because about a third of cases have been kids, adolescents, and they're not in part of the plan. That it's only 16 years and over, and overseas experience, American, UK experience, and our experience here with a third of cases being kids, they really do need to contact their federal or state representative and ask why are the children 12 years to 15 years not included, because no one wants to give a kid...
You're that concerned about it, are you, Professor? You want
yes.
activism to MPs to really get the message home?
Absolutely, activism, because otherwise, it took activism to start getting the young adults any priority in vaccination. They were ignored. They've been ignored right from the start, and yet we're a clever enough country to be able to have a couple of big ideas happening at the same time, compassionate rollout plus an epidemiological rollout. And now we're seeing Delta impact young kids. And it's not just our experience, it's international experience. So 12 years to 15 should be included.
Professor Mary Louise McLaws, your messaging is always so clear, and we really appreciate you joining us this evening. Thank you.
Stay safe.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.